afternoon, everyone, and welcome to today's edition of Black Health Trust. We are so happy that you chose to spend this time with us this afternoon. And we have, I think, a very engaging program lined up for you today. And without further ado, I'm going to turn it over to our founder, Dr. Randall Maxey.
Good afternoon, everyone, and welcome Dr. Nabors-Stevens and Dr. Ivan Waltz and Dr. Jocelyn Hines. Dr. Ivan Waltz, I hear you rode back on Air Force One. Is that true? Joe told me he had room for you.
I'm going to just let you continue on, Dr. Maxey. Thank you very much.
All right. So while Simon's finding the slides, I want to give credit to Dr. Barbara Nabors-Stevens and the Delta Sigma Theta. They had a program last week, and she shared some of her notes of what they did. I thought it was very interesting, and we're going to try a version of it today when we get to our slides. In the meantime, you had something you wanted to mention, Dr. Nabors-Stevens?
Yes, I wanted to bring up something before we get into the main event. It's a sad note, but I wanted us to pause and take note. This week, I heard on the news the sad announcement of the death of Dexter King and Joe Madison, both of which was sad news. But what struck me was both of them had been cut down by prostate cancer. And I tend to have a very concrete way of looking at things as opposed to the abstract, but I wanted our audience to take note. Here is a very concrete example of why Black men need to take care of their prostate health. It is very serious. And neither of these men were that old.
Remind us of who the second person is.
Joe Madison.
Remind us of who he is.
Joe Madison has had an extensive career in radio broadcasting, holds the world's Guinness record for longest podcast type radio show that he had. And I believe it has not been broken. He was on for 51 hours and has had been a voice for our people over the years, raising up those issues that are most important to our community. Both of these losses are great, and we didn't talk about it, but also the Secretary of Defense is having his battle with prostate cancer. Please, the males in your network, please encourage them to take care of their prostate health.
Well, thank you very much.
Well said.
Simon, can you put up the first slides? So I want everybody to get a piece of paper and number categories 1 through 10. And we're going to give a way to estimate your cardiovascular risk. So if my co-moderators would help me go through these slides, and we'll ask you, we have a set of questions, and if your answer is no to any of those questions, go to the next slide, Simon. This is something that's weighted, this first on nutrition. If you answer no to any of these questions, give yourself 1 point. At the end, we're going to add these points up. Dr. Hines, you want to maybe read this first question and we'll comment on it as we go through.
Nutritious diet score. So if you're getting 4 to 5 servings of fruits and or vegetables a day, then that's good. And if you're not, then you want to add a point. Okay, so I'm going to assume the more points, the worse. Okay. If you are eating high fiber carbohydrates, so what would be an example of high fiber carbohydrates? Because
Sweet
I don't-
potato,
what do you say?
sweet potato.
Okay, sweet potatoes is one. I'll give you a couple other examples here. Let's see, oats, blackberries, kidney beans, lentils, quinoa, brown rice, chickpeas, whole grains, almonds, avocados, apples, whole grain pastas, broccoli, carrots. Okay. If you're not eating those things, then you're going to add a point. If you are lowering your salt or sodium intake, that's great. And if you're not doing that, add a point. If you are eating lean proteins is going to be things like the chicken without the skin, preferably like breast meat. It's going to be your fish. It's going to be, if you do eat red meat, for example, in the ground beef category, right? You know how they sell the 80-20, the 95-5. If you're getting the leaner versions with less fat, if you're trimming the fat, any visible fat off the meat, then those would be lean proteins. If you're doing those things, then you're great. If not, you want to add a point. If we're eating healthy fats, again, healthy fats, I'll give you a list so we don't have to just go off the top of my head. But off the top of my head, that comes up things like avocado oil. Avocados are in the healthy fat category. Olive oil, flaxseed, chia seeds. Eggs are in general in the healthy fat category. Nuts, coconut oils, those types of things.
Somebody asked me about lard the other day, doctor.
That would not be, I was watching The Help, and there's this scene when she tells her, how Crisco has to go in everything, that Crisco is the cure for all things. And I was just thinking about the impact. Thinking about the impact of Crisco on the Black community and that cooking style in general on our taste buds and what we think tastes good and stuff like that. It was just an interesting 2-second little part of the movie, but in the context of this, also very telling to what we like. Anyway, so if you're eating healthy,
Dr. Hines, you're showing your age. Crisco is a very modern, refined form of lard. True lard is just.
Okay, so everybody had a chance to add their points. So keep a list because we're going to come back over these.
Keep going. Keep going.
So, let's ask Dr. Ivan Walks to do the next one. I know he walks a lot.
Okay. Number 2 on the cardiovascular list, cardiovascular risk score is exercise. And our points here go 6 out of 10. So if you are exercising 150 minutes per week of moderate activity or 75 minutes per week of vigorous activity, you're doing well. If you're not doing that, you get to add 2 points. Now, moderate activity would be going for a nice moderate walk. Vigorous activity is stuff that can hurt you if you don't do it properly. If you're heading to a place and there's a sign on the door that reads CrossFit, be careful and get good instruction, because that is vigorous exercise, but you really have to be prepared for that kind of exercise. And I think that's true for just about any exercise. Even if you haven't walked in a couple of years and you decide to get up and go for a mile or two, that's not advisable. Walk first to your doctor and then, or your practitioner, and then start on the exercise. So if you're doing your exercise, 150 minutes a week of moderate or 75 minutes a week of vigorous, no points for you. If you're not doing that, 2 points. And if you've sat on a red-eye flight for 8 hours and haven't gotten up and walked around, add your 2 points, because other kinds of risks come from that. Balanced combination of cardio and strength training. Very important to do both, not just cardio, but also maintain your strength, especially as you get less young. If you're not doing that, another 2 points. Is there a regular exercise routine? Or did you know Dr. Maxey was going to do this? And so last week you got your 150 minutes in, so you got no points up there. Go ahead and add your 2 points down here, because their exercise needs to be something that is a lifestyle and not just once in a while. So for those who had 6 points on this section of it, call Dr. Maxey right away. And those who have had no points on this, you can wait a week or two.
I have a question, Dr. Walks. Does walking in a shopping center to buy red bottom shoes count?
Absolutely. There are actually shopping centers in some communities where folks have walking clubs, and they'll open the shopping center early. So you can't buy the red bottom shoes when the place opens because the stores are closed, but you can walk around a few times, and by the time you're finished your walk, the store will be open. You can get red bottom shoes and a red brim hat to go with them.
So the point is, when you walk in the center and you're not shopping, that's good. But if you're stopping every 2 minutes, that's not good.
No, Dr. Maxey, it's not good for a lot of reasons to stop and buy stuff every 2 minutes.
Let's go to the next slide, Dr. Neighbor-Stephens, if you start the next slide.
All right, let's see how many points we rack up dealing with obesity.
Mm.
So if your BMI is below 25, you don't have to give yourself any points.
Let's talk about BMI just a minute. I think I sent out a link on the CDC. You can look up a BMI calculator, and it'll both in metric and in what we call English system. And you take your weight divided by your height in inches squared, multiplied times 703, and that will give you your BMI. But remember, a few weeks ago, we told everybody certain things they had to go and get. They had to go get their lab, they had to know their cholesterol to get their BMI. So you can calculate it. But go ahead, Dr. Neighbor-Stephens.
There was just a quick question, Dr. Maxey, about what is BMI, the body mass index.
There you go.
That's what those letters stand for.
And it's a calculation of whether or not your weight is healthy. It's not 100% accepted as the end-all, be-all of weight management, but it's what we have to work with today. Go ahead, Dr. Neighbor-Stephens.
All righty. Now, going back to the scoring, in case you forgot, if your BMI is not below 25, you're going to have to give yourself some points. But if it is below 25, you don't have to give yourself any points. You have recently discussed what your ideal body weight should be with your healthcare provider. I will even give you some leeway on that. If you've had this conversation in the last 12 months, then you don't have to give yourself any points. But if you haven't had this conversation, got to give yourself 2 points. Now, there's such a thing as healthy body density. This is a consideration of your combination of bone and muscle mass. And this is something that has to be calculated. I'm not aware of any online way. There are scales that you can buy that will calculate it for you. But you need to find out what that is, because as Dr. Maxey said before, the BMI is not the end all on this subject, and the body density is a part of the consideration. So you need to have the conversation with your healthcare provider, identify what your goal should be. If you haven't had this conversation, give yourself 3 points. If you have had this conversation and or calculation in the last 12 months, you don't have to give yourself any points. Sleep deprivation. Are you getting enough sleep? Adults should aim to get 7 to 9 hours of sleep per night. If your average amount of sleep is between 7 and 9 hours per night, then you don't have to give yourself any points. But if you are not getting at least 7 hours of sleep every night, then you need to give yourself 2 points. Sleep is very important. There are a lot of things that happen during sleep, and lack of sleep significantly increases your risk of your cardiovascular disease risk. It also can impact your cognitive function, and it contributes to obesity.
Dr. Nabor-Stevens, what's the effect of having to get up at night and go pee 2 or 3 times? Does that count? Does that break your sleep?
It does break your sleep. I hope it breaks your sleep. I hope you're not doing that in your sleep. The question is, how quickly can you go back to sleep? And if you can get up and go and then go back to bed and go right back to sleep, then that's not going to significantly decrease your total amount of sleep. But if you're one of these people, you get up and you go to the bathroom and then you're awake for another 2 hours, and clearly, if you don't make it up at the other end in terms of sleeping later, it's going to impact your total number of hours of sleep.
Well, thank you. Go to the next slide.
I guess it's who you want.
I'll do it.
Dr.
So-
Walks again?
I'll do it. So if you're not using any nicotine products, not chewing it, smoking it, drinking it, then that's good. But if you're doing anything with nicotine, even if you've been in a room with somebody else smoking it, give yourself 1 point. So you want to lower the risk of cardiovascular disease by staying away from any type of nicotine. So if you're not around it, don't give yourself any points. If you're around it in any way, give yourself a point. And high stress score. You got to keep your stress down. If you're managing stress through healthy means, such as meditation or exercise, if you're not doing that, give yourself 3 points. That's telling you how important stress is to manage that, because stress can kill you. It can equal a heart attack. It gets all of the wrong types of enzymes up. If you manage your stress through healthy means, again, don't give yourself any points. If you're reducing the risk of cardiovascular disease associated with stress, don't give yourself any points. But if you're not, give yourself 3 points. Let's go to the next slide.
And one additional comment: if you're using unhealthy ways of reducing your stress, that's not helping the situation. People turn to smoking, people turn to alcohol and other drug use, people turn to eating. All of these are unhealthy ways of managing your stress.
What about a good glass of red wine?
In terms of managing your stress, one
Yep.
glass is not a problem. And I'm sure Dr. Walks will second that. But if you turn to drinking a whole bottle of red wine,
What about 3 glasses?
For women, that is excessive. Women are not supposed to take more than a glass of wine or alcohol a day. And men, if I remember correctly, can have 2 beers and 2 glasses of wine. So if you are exceeding what is considered healthy limits, then you've crossed the line.
I would just like to question your conjunction. You said 2 glasses of wine and 2 beers. Did you mean or 2 beers?
I did, in fact, say or, a big or.
Okay.
Also in the context where we're talking about alcohol though, but in the context of alcohol, especially as a stress reliever or something to help you go to sleep, the sleep that you get from alcohol-induced sleep has been studied over and over again, and it is not a restorative and healing sleep. It's not the restorative and healing sleep that we're talking about that you need. So not all sleep is the same. There are certain types of sleep that help the body do the recovery and things that is needed to, impact some of these things that we're talking about as far as like cardiovascular health and obesity and hormone imbalance and that type of thing. And that's not the type of sleep that you get from alcohol-induced sleep.
So let me put a question to the panel. What about the use of benzodiazepines, such as, and you can name the trade names. How does that affect sleeping pills, Xanax, and all those things? And then also, specifically, Dr. Walk, how does sleep compare intellectually with a Sabbath?
What?
Okay, let me quickly respond with, there are, as Dr. Hines said, sleep is really, really studied a lot. And if sleep is a challenge for you, then going to a sleep expert, getting a sleep study, getting some understanding of what your particular sleep challenges are, make a lot of sense. There are some sleep medications that are better than others. And talking with your practitioner, your provider about that is, again, the place where we start is with getting professional advice that is specific to me, for me, and specific to each one of you, for you. I am of the opinion that benzodiazepines are not a good long-term solution for sleep at all. And so when you are getting a lot of the doctors do all kinds of things, because doctors are like every other profession. We're all different. And we may decide, but if your doctor is prescribing 6 milligrams of Xanax a day for you, that's really, really bad. So you really need to be sure that anytime any doctor ever prescribes any medication for you for any reason, anytime, those are all the absolutes I can find. Look up the medicine, read about it, learn about it yourself, learn about what the medication is typically prescribed for, learn what your doctor is prescribing it for, and learn how you're going to know that that medication is either causing you problems or is doing what it's supposed to do. How do you know you're getting the desired impact? When we start talking about medications like this that are easy to misuse, those are challenges. And Dr. Gibson put some really good information in the chat. You don't mix medications with alcohol, and really talk to your pharmacist about medications as well. Sometimes the doctor will prescribe something, the pill will change color. There's all kinds of reasons to talk with your pharmacist about medications when you go to pick them up.
Yeah, let me add one more thing to that. I'm glad Dr. Gibson put that in the chat. We have a lot of patients here who have pain and also have sleep problems. And typically they say, doctor, I want some hydrocodone or Norco or oxycodone. And I also want some benzodiazepine, some Xanax. And those two are both respiratory depressions. So you can wake up dead. So it is usual that you don't want to take both of those at once. I have a lot of old ladies who don't have a cough, but they want cough syrup with codeine in it. And some of them also want sleep medicine, and they also want pain medicine. And some doctors, just to get rid of their patients, not literally, but they'll give them all three. And that is super dangerous.
Yeah.
super dangerous. Okay, let's go to the next slide. That's neighbor Stephen.
High blood pressure. If you are maintaining your blood pressure within the target range for you, then you don't need to give yourself any points. But if your blood pressure is not within the target range for you, and I'm saying it that way because there can be different targets because of other comorbidities and other conditions, you need to give yourself 4 points because it is really important that you maintain your blood pressure within the appropriate target range for you.
I'm going to, can we have a little professional disagreement, Dr. Stevens? We know that a target blood pressure of below 120 should be everybody's goal. Some people think that if you're older, you need to get cerebral blood flow and the target should be 140 or 130. But the literature shows that unless you can't walk across the floor, unless you're having dizzy spells or hypotension, meaning you're symptomatic, that everybody should aim for that 120/80. You
Well,
want to
I'm a pediatrician and I would be concerned if some of my patients had a blood pressure of 120.
Well, we're talking about adults.
But that's why I said the appropriate target range for you.
Okay, I don't think any kitty pies on the phone.
Dr. Maxey, since you opened the door for professional disagreement, let me just go back to our wonderful champion, Dr. Jordan, about everybody needs a primary care practitioner, because I don't want any patients waiting until using I can't walk across the floor and I get dizzy as an indication that their blood pressure is not compatible with what's safe for them. And I know you don't either. So again, working with your primary care practitioner, understanding what blood pressure you're able to tolerate, knowing what the signs are that maybe your pressure is too low, monitoring your pressure regularly, all very, very important.
Okay.
High cholesterol. If your total cholesterol is less than 200, then you don't need to give yourself any points. If it is not less than 200, then you need to give yourself 3 points and have a conversation. Make sure that you have a conversation with your healthcare provider, because unless you're in an unusual situation, you probably wouldn't know that result unless they had done the blood work to get the result. I implore you, have the conversation with your healthcare provider and have a clear understanding of what you need to do to get your cholesterol where it needs to be. If they tell you that your HDL is high and your LDL is low, then you don't need to give yourself any points. But if they tell you either of those two things, you need to give yourself 4 points. Controlling your triglyceride levels is also important. And if they tell you that you have a low level of triglyceride, then you don't need to give yourself any points. But if they tell you that your level is not where it needs to be, then you need to give yourself 2 points. And make sure that you have a plan of action in hand before you leave that encounter, so that you know what you need to do to get these 3 things under control.
And if they don't know the answer, they should give themselves the points if they haven't gone to get the results. Give the points. The next slide, Dr. Hines, you want to take those?
All right, so if you have high blood sugar, then we're talking about a potential 8 out of 8 points in this category. So if your fasting blood sugar is less than 126, then you don't need to add any points. But if it's more than that, then you're going to need to add 4 points. If you are checking your blood sugar regularly and discussing those numbers with your healthcare provider, then you don't need to add any points. But if you're not doing those things and you're supposed to be doing those things, then you need to add 4 points to your score. In the kidney disease section, potential 7 points here. If you are monitoring your kidney health and addressing any issues that have been identified by your providers, then you don't need to add any points. But if you are not doing those things so that your primary care provider or other specialists have advised you to do, as far as taking care of your kidneys is concerned, then you're going to need to add 3 points. If you are reducing your cardiovascular risk through kidney health management, then you don't need to add any points. But if you're not doing the thing I just said before, which is monitoring your kidney health and addressing any issues, then by definition, you are not reducing your cardiovascular risk through kidney health management. So you get all 7 points.
Well, I
and
think
then,
I'm sorry, go ahead.
So I believe this is the end of our question set, and you're going to add up your scores, the scores obtained in each category. Oh, and the directions went away.
Yeah. I think you add them up. The top score would be 69, I think. If you had all the points where your answer was no, then I should add up to 69. And that would mean that you're at a estimated higher risk. But what we always say, we are not a medical practice on this show. We do want you to discuss these results with your provider and let them comment on it directly. But the estimate we're saying, if your number is 69, you need to go today, like Dr. Walk says. As soon as maybe you should hang up and go right now. But you need to see somebody as soon as possible. So that's the end of the questions. Let's see if we have any discussion or if we want to expand any of this. And I thank Dr. Barbara Neighbor-Stephens for generating this idea and a lot of the information, and let's have a discussion.
Question, Dr. Maxey, we know 69 is a bad score. What's a good score? Do we have to get 10 to have that piece of cheesecake tonight, or is 25 okay? What's a good score? Do we know?
Well, this is the weighted average. So you can be good in one area and bad in another one. So it's a composite score. There's no such thing as a totally good score. If you're good in one thing and bad in the other, that's not good. So this is a weighted score. How would you describe this, Dr. Neighbor-Stephens? This was your idea.
Well, we didn't do it the way that you did it, but what I would say is that you need to, if you have points, which means that you have risk factors, the way this was constructed. If you have any points at all, it means that you have some degree of risk for cardiovascular disease.
So it's in that particular category.
It's cumulative. All the categories contribute some degree of risk, right? So
all of these are risk factors that we talked about. So if you got points in any of them, you have some degree of risk that you need to pursue a conversation with your healthcare provider in order to quantitate and ameliorate that risk.
And I'll just add that some of the things, especially towards the beginning, if anything, rather than maybe Dr. Walks, rather than thinking about what's a good score, right? Maybe another way to think about it is these are all areas of concern. Obviously, to Dr. Maxey's point about different categories, the places where you got a higher score or you got all the points that were available, that might be places where you might want to focus some of your efforts, especially if you didn't know that some of the things that we talked about were risk factors for potential cardiovascular issues. And some of these things you can make a choice on. Information is great, but you can decide and look for, whether or not you want to eat lean proteins, or if you want to start targeting fruits and vegetables, or if you want to start targeting having a regular exercise routine. Because most of us, if you're not doing anything regularly, we're not starting at 150 minutes, right? But we can start something regularly. So that might be another potential way to take home something. What are some things where I did get points? What are some places where I, as an individual, can kind of take some action? And then, there's some categories where I'm going to need to get some information and some help. And I didn't even know that was a factor.
Dr. Hines,
So,
let me ask you a question. Before we go to some of our non-physicians and Dr. Walsh, we want him to comment. Like, I have trouble eating fresh fruit, but what if I eat applesauce with no sugar added? Can I do something like that?
So it's better than nothing, right? So there are a lot of ways to get your servings of fruits and or vegetables. Luckily, especially in these here United States, there are enough options for the majority of us where you can find something that you like. So in general, there's usually fresh is best, right? And then after that, you can get some frozens and things of that nature. Then there's what? You have to be careful about anything. Once something's been processed, sometimes the processing has taken away the nutritional value and things of that nature. Canned is an option if you're using the one in 100% juice, not in syrup. There are a lot of options to get in your fruit. You can put it in smoothies. You don't have to eat it fresh. You can put it in your blender. There's all kinds of ways. And again, it said fruits or vegetables. So there was a campaign from maybe CDC, I don't know, whoever it was, about Eat the Rainbow, right? So eating various colors of fruits and vegetables can help you get the benefits of those fruits and or vegetables. So if apples aren't your thing, and if it's not the red apples, not the tart, not the sweet, not the crunchy, not the soft, because there's about 15 different types of apples at the grocery store. If none of those work for you, and just skip to a different fruit or vegetable.
Thank you. Dr. Walsh, you're going to make a comment, and then I want to get the floor open to some non-physicians.
Okay, I know, well, Dr. Lawson has had his hand up for quite a while, and Dr. Sherrod's hand is up. The reason I asked the question about a low total score is that there are a couple of these categories where I can be feeling really, really good that my total points were only 20, but I'm about to lose my kidneys. Are going to shut down and we can't live without those. And so I raised the question to get just those responses. Most of the time we are taught to look at our total score and look at how we did. And this is one of those assessments where you can have a really low total score and so I'd like to propose that we maybe think about as opposed to an overall health scale, we should have a Black Health Trust health scale. Because if folks are regular, not listeners, but regular participants in some of the advice, recommendations, and suggestions, we should have a healthier group than the general population. So I just wanted to toss out there that don't be like me thinking oh man, I only got 15 points and I don't have any kidneys tomorrow. So with that, if we can, Dr. Maxey, with your permission, if we can unmute Dr. Lawson and Dr. Sherrod and then open it up.
Let's do that, and then let's open it up. Dr. Lawson?
Yeah, thank you very much for that excellent discussion. And it also raises some, I think, key issues in which this group can serve to be advocates of. Unfortunately, in some communities, you cannot get fruits and vegetables very easily. When I lived briefly in Texas, I literally went to some restaurants, and there were some restaurants that did not serve green vegetables. They just didn't, and were exceedingly popular. Also, we worked with the community to try to deal with the absence of shopping centers, and some of them refused to start up in some of the communities because the people refuse to eat fresh fruits and vegetables. Then there's the work by James Jackson and others who showed that we deal with stress by unhealthy habits, believing. I've been frequently told when you're over 60, you need to sit in a wheelchair to save yourself and allow yourself to get some rest as much as possible. Frequently, we're told to drink to be able to relax and take it easy. And I would go on a limb and say that there's a lot of folks who are promoting marijuana alternatives to try to deal with relaxation and stress, when in fact the evidence shows that these agents simply aren't very good in the long term for stress. And then finally, I would just want to note that many mental health clinics, as well as many virtual practices, do not allow benzodiazepines. And the reality is we do have alternatives. They don't give you the buzz that Valium and some of the other agents do, but we do have alternatives to these agents for both sleep as well as reducing anxiety. And I just also want to mention, in terms of the sleep issue, that study after study has shown that African-American youth in this city simply do not get much sleep. And that shows up very clearly in terms of high obesity rates, as well as ongoing problems that themselves do not do a good job in providing an environment. And the city environment is not a good place in terms of making sure that kids get adequate amount of sleep.
One comment I'd like to make on what you said, Dr. Lawson, in high density places in the urban area, at least in LA, maybe DC, we have helicopters and sirens, police
That's
sirens, night long. Dr. Sherrod, then we're good. I want to go to some of our non-physician people to comment and make questions. Dr. Sherrod?
Oh, yeah. Thank you, Dr. Maxey. And thank you, Dr. Stevens, for coming up with this idea. This is excellent, I think, because we know that heart disease is the #1 cause of mortality in the United States, with cancer being #2. And I think this is an excellent guide to what I've been preaching, is each individual should take responsibility for their health. And this gives them something concrete to do. Now, by no means does this mean that if you got 0 points on this, that you're not at risk. There are risk factors all the time, but this at least gives you some idea of where you are, and something that concrete that you can kind of know yourself and take to your primary care physician and manage your health. It's about managing your health. Now, the thing that this leaves out is the fact that cancer is the #2 cause of death in the United States. And then, we need to talk about environmental factors, pesticides in the diet, in the food, all of those
This question there
things.
was about cardiovascular risk. We haven't tried to be complete. This was
I understand. I just want them to know that is also, that's the part that's missing. But I want to say also that sleep deprivation is a major category, because if you don't sleep, you don't rewire your short-term memory, and you don't make immune cells.
Okay.
So you are decreasing your cognitive function as well as your body's ability to protect itself, because that's what your immune system is made for, to protect.
You're right on target. I appreciate you. Let's see if we have any comments from some non-physicians on the line. This is who this is for. You seen anybody that we can call on, Dr. Neighbor-Stevens?
Questions. There was the comment made that drinking wine or taking pills does not help the individual to address the stressful issue, and the problem still exists in the morning. Teaching individuals coping skills, problem-solving techniques would be more beneficial.
Who was that?
That was Ms. Tanner.
Let's unmute her. Ms. Tanner?
Yes, that was me. And I guess kids, I might not say kids, just not kids, but I think people are not learning coping skills these days and how to deal with stress. And just to compound it by taking medicine, for me, has never been an option. It doesn't make any sense if you don't know how to deal with it. Just because you take a pill or drink wine, the problem still exists if you haven't learned how to get some solution. Sometimes people are stressing out on stuff they had no control over. So you have to learn how to decipher if this is a problem that I need to deal with or leave it alone. So I guess I'm not an advocate for just giving a pill as a quick fix for stuff.
Okay. Any other non-physician have a comment or a question? What about Dr. Brooks down there in Florida? Or anybody in Louisiana? I know I'm being unfair.
Nobody's stepping up. I guess we don't have any questions,
Or comments?
but I hope we at least gave you.
Juliana Taylor has her hand up.
Okay, let's recognize her. Ms. Taylor?
Hi, I had a little bit of trouble unmuting. Good afternoon, everyone. Although my background, as you already know, is in public and community health as an educator, I still I'm guilty of not getting enough sleep. My sleep hygiene is not what it should be. And as I say to folks all the time, it's easy for those of us in health professions, whether on the clinical end or education end, it's easy for us to give presentations, et cetera, to folks, always telling them what to do regarding their health and well-being. But we don't practice, as with myself, what we should be doing, what we preach to folks, so to speak. But that's one area that I definitely, since childhood, I've been more or less a night owl, so to speak. So I'm working on it. I'm still a work in progress, but that's definitely one area. And I know better. All of what was said about the importance of having good sleep hygiene, I've learned about in and out of the classroom. But I need to do better with that area.
Well, thank you so much. What about Gretchen?
You're welcome.
Gretchen, you have a comment? Or Miss Eula Dickerson? Go again to Mr. Brooks. I'm trying to get a little bit of discussion going from non-physicians. We always do the talking. Well,
Gretchen had some comments in the chat about some additional coping techniques for cardiovascular health and stress could be things like Tai Chi, stretching exercises, and various forms of meditation. Again, all of those are absolutely areas that have been proven to show great benefit as far as just overall health and well-being. Stretching and flexibility is often something that gets missed when people are talking about exercise, but flexibility is really actually also a very critical part of a balanced exercise routine, because that lack of flexibility can impact things like, being able to have back mobility and neck mobility, shoulder mobility. Those are some of the places where people often have things that impact their activities of daily living when they don't have that mobility in those areas to be able to reach the back of your head, to be able to turn your head, to pick something up off the floor. So flexibility is something that often gets missed in that exercise space.
when
I was able to unmute. This is Gretchen. May I speak?
Yes, ma'am.
Okay, I just wanted to say that starting early, social emotional learning is so important and it needs to start at a very early age. And if children are able to learn how to cope, that carries over into their adult life. It becomes more difficult as people get older. So I just wanted to state that.
Well, thank you so much. If Simon is available, I'd like him to comment a minute on Tai Chi. When I was in China, every morning we got up and go to the public square, and all the elderly Chinese people were out there doing Tai Chi. Simon, you got a comment on Tai Chi and what that helps with?
I don't know anything about Tai Chi, but general principle of martial arts, you meditate to calm your mind and calm your body, and anything that can make you calm has a positive impact on your overall health.
Okay.
Dr. Maxey, I did study Tai Chi, and I do want to add to Dr. Hines' excellent focus on flexibility with a needed focus on balance. You talked about folks, if you can walk across the room and not fall down as one potential challenge with blood pressure readings. But it is very important that, especially as folks get older, that they do exercises and develop strategies to work on their balance. I can go on and on about it, but Tai Chi is great for a lot of reasons, for flexibility, for health, for balance. But to go back to what we talked about earlier with Dr. Sherrod, there are so many things with our focus on cardiovascular health today, so many additional things that we can bring up.
That's good. Let me bring up something about the blood pressure thing. If you're on blood pressure medicine, and especially if you're older, I advise my patients not to just jump up. You don't jump up, you get up slowly, and that will make sure you don't have orthostatic hypotension and fall. But if you just go from lying down, being supine, and all of a sudden you're standing up, anybody can fall on that. But you want to keep your pressure as low as possible, but you don't just go from one state to the other. And I also advise older people to wear support hose a lot too. So we can discuss that at another time. So we're at the top of the...
So Dr. Maxey, I always get excited when we get into some of these conversations, and I'm glad that some of the non-physicians are involved, because so much of healthcare is practical stuff, right? We're talking about making sure that we keep our blood pressure low. You're talking now about how you get up to make sure that you don't have orthostatic changes, which means your blood pressure changes because you change your orientation from lying down to standing up. But also dehydration can make you jump up and become dizzy. And dehydration can impact your kidneys. So there's so much of this that are things that we can talk about in the non-physician space that just makes sense in terms of how we are fearfully and wonderfully made, but our bodies we can't just look at one part of it. It's related. So yes, hygiene is important, sleep hygiene is important, drinking water is important, all of those things. And don't let me get into Dr. Sherrod's territory, but there's so much that we need to just do.
You forgot to answer
Dr. Neighbor-Stevens, common sense, is that what it's called?
Dr. Walks, you forgot to answer one of my questions. I asked you to compare sleep with Sabbath.
Dr. Maxey, I can only answer questions I can understand. I know what in the Sam Hill you were talking about, comparing sleep and Sabbath. Help me with that. Maybe, why don't you ask Dr. Lawson that question? He can answer anything.
Dr. Lawson, I'm just trying to say that resting is very important. And that's what I equate a Sabbath with.
What is very important?
You even have to take a Sabbath in the way you plant. You have to rest the soil and rotate your crops. We'll get into that to another time.
Yeah, I think you hit an excellent point earlier on that there's sleep and there's sleep. All we have multiple stages of sleep. A key element in terms of sleep, of course, is being able to get good old REM sleep. which many times many of us don't do.
What does REM sleep mean?
REM sleep means resting rapid eye movement sleep. That's the type of sleep where you go in, and if you look at a person's eyes, you can see the eyeballs moving back and forth. This is also associated with dreaming and so forth. And we find that in addition, there's also emergent stage 4 sleep, which is extremely important as well, because you go extra deep and does some of the physiological changes that we talked about earlier. Now, the problem with a lot of us is we don't, especially as we get older, is we're sleeping sort of with the eyes open. If you check the brain, you see sort of little delta activity, but not much. And not getting restorative sleep. The beauty of religion, spirituality, and others is that you don't have to go to sleep to get these restorative changes occurring in the brain, because they're going to lead to the kinds of EEG changes that you can get from doing meditation and from doing also certain types of hypnosis as well.
Well, thank you. Let's go with our final words. And if there's any other comment from our watching audience.
Dr. Maxey, before we go to final words, I want to try to step into Dr. Neighbor-Stevens' space for a minute, because I was told very clearly by another physician that when we talk about sleep, we have to remember, and I want Dr. Neighbor-Stevens to clarify this for me, that with young children, sleep is critical for the release of growth hormones. So if you want children to have normal growth patterns, they need to get some sleep. Dr. Neighbor-Stevens, can you talk a little bit about that from a pediatrician perspective?
Yeah, absolutely. In fact, when we started this conversation about sleep a few minutes ago, that's where my mind went immediately, to the need of children having adequate sleep. And that's also why when I was given the values of sleep, I was specific and said adults need between 7 and 9. Children can actually need more than that, depending on their age and the activity level. So these, and also children need structure and scheduling in order to organize themselves. So it's not a good idea to let kids, especially young kids, stay up late doing whatever they're doing. They need to have a schedule in their life. They do much better if they have a schedule in their life. Now, there's been a lot of conversation about the need to change school hours, because in a lot of communities, especially the older kids, the junior and senior high school kids, have to catch the buses as early as 6:30 in the morning. And so, as you can clearly see, if they have to be on the bus stop by 6:30, that means they've got to get up at least by, well, preferably by 6, but ideally at least an hour before, so that they can have breakfast and get themselves together and all that. So that means a very early rising. And typically adolescents do not go to bed early. So they are getting into a pattern of much reduced sleep time. And people are showing studies that it's interfering with learning. They're hungry, they're sleepy. So we need to pay attention to everybody's sleep from birth to death.
And let me just add a little bit to that. If you have a child or a grandchild that is sleeping but is absolutely snoring and struggling, they need to go and see a doctor, because there may be tonsils, adenoids, whatever else is in there. And so they may be in bed, but they're not getting that kind of restful sleep that we've talked about.
Well, thank you so much. I think we're at the top of the hour past. Let's go with our final comments, Dr. Hines.
So this is a great discussion, and it was good for me to look up some of the definitions on some of these things and the amounts and servings. So some of the things that we answered questions on, it might say, what's a good amount? Like what's my triglyceride supposed to be? So the joy of the internet is that you can look up the details that are on here. For those of us that are able to see the chat there, I put in things about what are the stages of sleep, right? And what, when you're going through them, what happens with your body and all the different stages. That information is available online. To Dr. Lawson's point about the availability of fresh fruits and vegetables, there's also things from the American Heart Association about different ways to get your fruits and vegetables in, that come, whether it's dried, frozen, canned, there's ways to get them in. So there's recommendations on how to do those for breakfast, lunch, and dinner. There are a lot of things out there that if this discussion has piqued your interest in a particular area or made you curious about how you can incorporate some of these things into your life, what they are, what is Tai Chi, how can I check my flexibility, all of these things. We can use AI, we can use just the regular internet, we can call our primary care doctors, we can find out more.
Well, thank you, Dr. Hines. Dr. Walks?
I have a complaint, Dr. Maxey, and I'm really upset about this entire thing because I went ahead and used the BMI calculator, and my BMI is 25.1.
You're
Okay,
over.
so I am not happy at all. 25.1 means I get all the points for the BMI being too high, and I think it's not fair. I want to write a letter to the editor. And in all seriousness, it just really shows how individual these things can be. And my final comment is this: you made a point, Dr. Maxey, about how important this is for non-physicians. 2 physicians that I know personally died in the past week because of things that were related to, none of them looked like they exercise neither of them looked like they exercise 150 hours a week. I know physicians that smoke. I know it is very challenging because, to Dr. Lawson's point, that stress part, we will do all kinds of unhealthy things to deal with the stress part. So I think this is maybe even as important or more important for those who are physicians or have other high stress occupations, because what you have a passion for, what you want to do to help others, really can kill you. And so I just want to make sure that all of the physicians who are listening have taken the test seriously and are concerned about our own health, because we can't give what we don't have. We can't help other folks if we're not willing to keep ourselves healthy. So thanks for bringing this up, Dr. Maxey.
Thank you, Dr. Walks. Dr. Barbara Neighbors-Stevens, DST.
Well, I hope that this was helpful and has given people, everyone, something to think about and something to work on. Because I suspect there isn't anyone who didn't get at least 1 point. And I want to encourage our audience, if there are topics that we have not touched on that you would really feel that you would benefit from some form of presentation regarding those topics, please feel free to put them in the chat. There are a lot of topics that we never run out of things to talk about, but we also want to make sure that we're meeting your needs. So please feel free to drop suggestions in the chat.
Thank you so much. I appreciate everybody's participation. I want to make a comment based upon what I've seen in the news, and I want people to consider what may be in their best interest. And we're not a political show, but we do know that even though some things may not be 100% preferable to us, we know definitely things that are detrimental to us. And to exercise your voting rights and what your thoughts are and who those people are that you think are better for us, even though we have some disagreements with. It's better to be heard and have part of what you want than not to get all of what you want, but you certainly don't want to put an enemy in offices. And that stands up and down all of these tickets, because that can lead to your stress, your discomfort, and all the things that we are faced with. And I get very angry every time I hear one of these people from the Sunshine State say, don't be woke, don't know what's going on with you. Just ignore the fact that we don't believe slavery was bad. Don't believe that you're not living in a country that has racism that affects you. So have a great Sunday, everybody. Enjoy yourself, and when it's appropriate for you, please go and vote and express your thoughts and your will. Have a great day. Thank you,
Good
Simon.
day, everyone.